Thank you very much, Congressman Ellison. I think that one of the interesting things about the debate that's going on in Congress right now is that the debate seems to be that we can't have a single-payer system in this country. The people aren't ready for it, or it won't work, or whatever. There's all kinds of myths around that. And one of the fascinating things about it is that now as we come to the President's proposal, he's proposing that we have a public option among those choices that people will have when the National Health Plan is put in place. Now, everybody immediately says, "Oh, we don't want a public option. We don't need that. The private industry has, they'll come up with enough options, and people will have choices. The problem is people don't have money to pay the premiums." Well, the fact is that the American health insurance, or the insurance industry, has had full chance to do it since 1933, when Franklin Delano Roosevelt took this off the agenda. They've had more than 70 years, almost 75 years, to come up with a plan to cover all Americans, and they have not done it. Now, there has to be a public option, and it has to be a good option. There's an interesting thing in reading about this whole thing. It's called "Do Not Resuscitate," meaning do not resuscitate the health insurance industry that's dying. But that means we've got to have a good public option out there for people to choose. Now, people say, why do we need a public option? You need the competition of the public option to drive the health insurance industry prices down. What's happening today, in fact, when Mrs. Clinton tried this effort 15 years ago, in 1993, we had almost 1,800 insurance companies in this country. That industry is rapidly contracting to the point where today we have around 800. And in many states, particularly rural states in this country, they have one choice of an insurance company, not two. So you've got an insurance company, or maybe you'll have two, but there's no competition in that kind of situation, and you need the government plan. Now, the reason why is that? Well, very simply, Medicare has an administrative cost of about 3%. That means you give $1 to Medicare, 97 cents goes out in health care benefits to older people in this country. If you give money to a private insurance company, 82 cents on average goes out to people. In many companies, it's 70 cents is all that gets out to people who are sick. So we need a Medicare-like, a government option to compete with private industry to drive down those costs, because costs are what are killing our healthcare system today. Costs are going up much faster than inflation. People are finding their deductibles higher. They're finding their co-pays higher. They're spending more and more money out of their pocket, even though they have health insurance. They think, well, I'm covered. I got this illness, but I don't have to worry. I'm just going to go and have it. And suddenly they find out they've got huge bills left after, and that's because the plans are simply not taking care of people's needs, and we need a government option. Now, there's several things about a government option. First of all, it has to be one in which it takes anybody. You can't give the insurance companies or anybody else the ability to say, I'd like to take that person, but I don't want to take that person. That person's old, or that person looks sick, so I don't want to take care of them. I just want to take premiums from people who are healthy. And the government option has to be one that takes everybody, and so do all the private insurance industry. If we have a health care bill that goes out of this House that does not have insurance changes in it, that requires everybody to be taken, then we haven't done what we need. You heard the disparities in minority communities in this country, and it's just poor people. It's really not minorities as much as it's poor people don't have the same kind of health care that people do who have a lot of money. I mean, that's the way it is. And we ought to be honest about that and say, if we're going to do a national plan, it takes everybody. Now, it also has to give the same set of benefits. Whether it's a private plan or a public plan, it ought to have the same benefits. Now, if the private industry can compete with a government plan, that's fine. But if they can't, they're going to have to find ways to bring their prices down. They're going to either have to squeeze their profits or do something to change the way that goes. Pre-existing conditions. I had a patient, or a woman in my district, who was an opera singer. She went to Germany, had a contract in Munich. The minute you go into Germany, you're in the German system. You're taken care of. Her daughter got leukemia. They spent thousands and thousands of dollars in treating the child. She came back. She was perfect. The child had remission. And so they came back to the United States. The woman couldn't find an insurance company in the United States that would give her insurance, except at exorbitant rates, $2,000 a month. Now, why is it that the Germans can figure a way to do that, and we can't in this country? And my view is that you have to have no pre-existing conditions, you've got to let everybody in, and you've got to give benefits. And I